Hello, everyone, and welcome to our Cultural Competence and Cultural Humility workshop. Today, we will talk about the importance of facilitating diversity in healthcare for nursing students. My name is Livia Manka, and I'm going to be the facilitator of this session today. To kick things off, let's do a brief icebreaker to get us all comfortable and prepared to dive into today's topic. For this activity, we are going to answer some culture-related questions. The first question: if you could visit any country to learn about its culture, where would you go and why? The second question: what is a stereotype about your culture that you would like to dispel? And the third question: discuss a cultural value or tradition that is important to you. Let's take a moment to reflect on these questions and share our answers. Feel free to type your answer in the chat or unmute to talk. All right, now that we've completed our icebreaker, let's move on to the main topic for today. The objective of this workshop is to define the importance of cultural competence, assess our personal cultural competence, and learn applicable resources and apply learned concepts through case studies and practical scenarios. Here are a few statistics to help us understand why cultural competence matters. The US population is over 40% racially or ethnically diverse, according to the 2021 census. Challenges encountered in healthcare include language barriers, implicit bias, and lack of training. Some opportunities gained from being culturally competent include enhanced problem-solving skills and improved patient outcome. As nursing students who will become future healthcare leaders, these are all positive outcomes we should aspire for. In order for us to understand cultural competence and humility, we need to be able to define it. So, what is cultural competence? Cultural competence is the ability to effectively interact with diverse populations. And cultural humility is an ongoing self-reflection and learning which involves acknowledging one's own limitations and being open to the beliefs and experiences of others. Both concepts are essential for patient-centered care. Here are some benefits of cultural competence. Evidence shows that training healthcare professionals in cultural competence leads to reduced health disparities, improved patient satisfaction and trust, and better treatment, adherence, and health outcome. Studies have shown that cultural competence improves health, reduces health disparities, and improves patient-provider communication. It promotes equitable care and increases patient satisfaction. For example, there have been a 15% improvement in diabetes management for Hispanic populations as a result of cultural competence. When it comes to cultural competency in healthcare, some challenges faced include language and communication barriers, bias, and limited cultural competence training in nursing education curriculum, which can lead to mixed diagnoses, mistrust, and eventually poor health outcomes. Cultural competency promotes diversity, which is very crucial in nursing and healthcare in general. Diversity allows healthcare providers to better understand and cater to the needs of people with different backgrounds and cultures. As a diverse workforce also brings a wider range of perspectives to problem solving, fostering innovation in healthcare practices. As a nursing student, you're considered a future leader in healthcare. Understanding cultural competence will help you to develop empathy and adaptability, help you navigate cross-cultural interactions effectively, and advocate for inclusive care policies and practices in your various employment settings. As future healthcare leaders, it is your responsibility to advocate for cultural competence training in healthcare settings, mentor peers and promote inclusive care policies, and utilize provided resources to improve cultural awareness continuously. Next, we will look at the infographics for cultural competence and humility in nursing students. In this infographic, we have an overview of diversity in the US population. Fact, the US population is over 40% racially and or ethnically diverse. Based on the 2021 census, the US population is 59.3% white and not Hispanic or Latino, 18.9% Hispanic or Latino, 13.6% Black or African American, 6.1% Asian, 2.9% two or more races, 1.3% American Indian and Alaskan Native, 0.3% Native Hawaiian and other Pacific Islander. 54% of health workers self-identify as whites and 79% as women. The nursing workforce needs to reflect the community it serves for equitable care delivery, hence the need for cultural competency. Cultural competency matters to nursing students because it prepares them for diverse clinical settings, improves communication, and encourages empathy and adaptability in complex scenarios. In order to build a cultural competent workforce in nursing and healthcare in general, we need to incorporate regular trainings and workshops and create policies that promote inclusivity and diversity. Here are some additional resources to help you deepen your understanding of cultural competency and cultural humility. Next, we will move into our group activity. The objective of this activity is for us to explore and reflect on our understanding of cultural competence and humility, and how we're going to apply these principles to real-world scenarios, and then we'll discuss actionable steps to enhance our approach. So first, we'll split you all into groups, and each group is going to be handed a scenario card. These cards are going to have different scenarios, and you will discuss among yourself as a group and how you'll navigate this scenario, and then you will share your response with the rest of the group, how you handle the scenario that was handed to you. All right, next we are going to move into our case study. For our case study, we're going to look at a 45-year-old male patient who doesn't speak English. So the nurse communicates with the patient's daughter, who then translates to her dad. And here we have some discussion prompt questions related to the case study on the previous slide. Now I will go ahead and open the floor for any questions. You can go ahead and unmute yourself to speak or type your questions in the chat. If questions do arise later after this presentation, please feel free to reach out via email. Our contact information is going to be on the final slide of this presentation. Thank you all for attending this workshop and training session. I hope you found this session engaging and took away some valuable insights. We would love to hear your feedback on today's session, so please use the QR code on the screen to complete our evaluation form. Your feedback helps us improve and ensures future sessions, which are going to be more effective. We look forward to having you in our future workshop. Thank you. And here is our email, so you can reach us with questions or feedback.